Hello students, welcome to Pharma Syndrome channel and today our session is on thrombolytics as well as fibrinolytics. So for more interesting details regarding pharmacy related coaching as well as pharma job updates, so subscribe to our channel and let's have a look on so what is simply thrombolytics as well as fibrinolytics. So the name itself indicating they break down thrombus formation as well as they break down the formed fibrin. So I hope you know. Yesterday itself we discussed. So thrombus is nothing but it is a clot. Generally, it is large size. It is somewhere in the blood vessel in the attached form. So generally, it is a attached form. But embolus will be so this thrombus will be breakdown, and that breakdown parts will float in the blood vessel and reach somewhere parts of the blood vessel and may they block the blood vessels. For example, yesterday it's example pulmonary embolism. So emboli nothing but it is a part of thrombi only, but it is a floating in the blood circulation and it's somewhere stuck in the blood vessel. And if it is somewhere stuck in the blood vessel, it may leads into the different clotting disorders. So here our drugs break down this thrombus as well as break down the fibrin. So here regarding the explanation part, these are the drugs that are used to lysis or dissolve thrombus or clot in blood vessel in order to recanalize the occluded vessels. So, a blood vessels lo aithe general ga clot form avadam valla circulation anedi aagipoyindo వాటిని మళ్ళీ రీకెనలైజ్ మళ్ళీ వాటిలో ఫ్లో అయ్యేలాగా చేయడానికి these drugs are helpful. How they are helpful? They break down the thrombin as well as thrombus as well as fibrin. So fibrin is nothing but that is a mesh polymer. Nothing but a fibrin become single unit and that single unit become polymer unit. The polymer fibrin is insoluble. The polymeric fibrin is insoluble and that become meshwork-like structure. That meshwork-like structure attract more platelets and responsible for the clot formulation. And here the fibrinolytic system dissolves intravascular clots as a result of action of plasmin. So fibrinolytics. So fibrinolytics are the drugs. They dissolve clots present within the blood vessel. It may be in the form of emboli. It may be in the form of thrombus. So thrombus clot is nothing but formed with help of thrombin. So thrombin is the active form. That active form produced from the prothrombin. So prothrombin, nothing but thrombin is a clotting factor 2. So here the breakdown of thrombus or fibrin is because of plasmin. So plasmin is one of the type of enzyme that break down the fibrinolytic system as well as a thrombus system and it decrease the formation of clot. And here number of drugs are there like streptokinase, urokinase, alteplase, and all are like enzymes end with ase. So all are like enzymes. All are like end with ase. That is enzymes. And here these drugs are the enzymes. That enzymes break down the thrombus as well as fibrin system and decrease the clot formation. Next, discussion regarding the individual drugs. So here there is a no specific detailed classification. Simply examples will be there. So regarding first drug is the streptokinase. So streptokinase is a protein. So enzymes nothing but proteins. Proteins nothing but made up of amino acids. So protein derived from beta species of hemolytic streptococci. So streptokinase is derived from the microorganism Streptococcus species. And when coming to urokinase, it is from the kidney cell culture as well as the urokinase first identified in the human kidney. And the alteplase is from the DNA technology. So streptokinase naturally from the microorganism source and urokinase is directly from the human source. And alteplase, telomerase, reticulases, like number of drugs are there. All these remaining drugs are prepared by rDNA technology, recombinant DNA technology. And all these enzymatic drugs, nothing but fibrinolytics or thrombolytics are tissue plasminogen activators. When these drugs activates the tissue plasminogen, nothing but that plasminogen converts to plasmin, and plasmin having the capacity degrade the thrombus as well as fibrin. So here all these drugs convert plasminogen to plasmin. When plasmin is produced, that plasmin causes degradation of fibrin meshwork as well as degradation of thrombus formation. And regarding streptokinase, okay. So regarding streptokinase binds with the circulating plasminogen to form a complex that activates plasminogen to plasmin. And the streptokinase binds to both the circulating and fibrin bound plasminogen are activated. అంటే జనరల్ గా సర్క్యులేషన్ లో ఫ్రీగా ఉన్న అలాగే ఫైబ్రిన్ కి బైండ్ అయిన ప్లాస్మినోజన్ ని ప్లాస్మిన్ గా మారుతుంది. When there is a conversion of plasminogen to plasmin, that plasmin degrades the fibrin mesh as well as a thrombus clot. And the urokinase directly activates plasminogen to plasmin. And when coming to streptokinase as well as urokinase, the recombinant preparation, RDNA technology drug, altiplase, retiplase, teniptase, number of drugs are there. Apart from streptokinase, urokinase, remaining thrombolytics or fibrinolytics are prepared by recombinant DNA technology. And when coming to altiplase, the RDNA product, more effect on plasminogen that is bound to fibrin than సర్క్యులేటింగ్ ప్లాస్మినోజన్. అంటే బ్లడ్ లో సర్క్యులేట్ అవుతున్న ప్లాస్మినోజన్ ని పక్కన పెట్టేస్తే ఆల్రెడీ ఫైబ్రిన్ కి బైండ్ అయిన ప్లాస్మినోజన్ ని తొందరగా యాక్టివ్ గా మారుస్తుంది. ఏ విధంగా? కన్వర్షన్ ఆఫ్ ప్లాస్మినోజన్ టు ద ప్లాస్మిన్. దట్ ప్లాస్మిన్ డిగ్రేడ్స్ ఫైబ్రిన్ యాజ్ వెల్ యాజ్ థ్రాంబస్ ఫార్మేషన్. ఓకే. So that is regarding drugs of regarding simple introduction as well as mechanism of these drugs. But these drugs are also having drawbacks. Let's have a look on that also. Let's see what are the drawbacks of these fibrinolytics or thrombolytics. And especially these drugs are tissue plasminogen activator. When plasminogen converts to plasmin, that plasmin degrades and shows action like thrombolytic as well as fibrinolytic. And so as streptokinase is from the microbial source, so it is like a foreign body to the body and a foreign organism to the body. So that's why the streptokinase may generate antigenic reaction, allergic reaction, maybe pyrogenic, increase the body temperature, and can be destroyed by anti-streptococcal antibodies, and generally it is the less expensive. So generally streptococcal source it is. So when streptococci like foreign particle enter into the body, the antibodies generate against this streptokinase, and these antibodies may damage the drug. And apart from that, the streptokinase is less expensive. And regarding urogenic, it is a human source only. So there is a no allergic reactions, no antigen formation, and it is not destroyed by the antibodies. So urokinase is compared to streptokinase safe because urokinase, it is from the body kidney cell source itself. So it is compatible to our human body. There is a no problem with the urokinase. And when coming to altiplase, it is the RDNA technology product. No antigen reaction, does not degrade by antibodies. It shows rapid action with a short half-life. అంటే తొందరగా యాక్షన్ చూపిస్తుంది, తొందరగా బాడీ నుంచి ఎలిమినేట్ అవుతుంది. ఇట్ ఇస్ అ మోర్ పొటెంట్. ఎట్ లో డోస్ షోస్ గుడ్ యాక్షన్. Low dose shows the good action, and it is more effective and expensive also because it is prepared by recombinant DNA technology. So there is a chance of expensive in nature. And generally most of these drugs by intravenous route of administration. And when coming to urokinase, initially it may be like intravenous formulation followed by bolus and followed by intravenous infusion. So infusion means continuous administration. And like altiplase also similar to the urokinase. So initially as a IV bolus and followed by the continuous intravenous infusion. And regarding adverse reactions, The streptokinase shows bleeding, hypotension, as well as allergic reactions. So there is a chance of bleeding because excess dose or continuous usage of these drugs produce bleeding. Why? These drugs are breakdowning the fibrin mesh and preventing the clot formation. If the clot formation prevention continuously happening, there is a chance of bleeding. That's why continuous usage of anticoagulants develops the bleeding. And here also regarding urokinase, bleeding is common. Hypotension, allergic reactions are rare. Allergic reactions are higher with streptokinase. But when coming to here, there is a low risk of bleeding and as well as allergic reaction. So recombinant products are safe, but they are expensive in nature. So expensive nature is also one of the factor in the treatment because not all people are affordable. So, but alteplase is safe compared to these two drugs because there is no allergic reactions as well as less risk of bleeding also. Less risk of bleeding also. So, this is simply regarding introduction as well as pharmacology of thrombolytics or fibrinolytics. Thrombolytics or fibrinolytics. So, this is the image you can observe in the KD Tripathi also. So, this is from the KD Tripathi textbook source. You can observe clearly here. And generally, these fibrinolytics or thrombolytics are also known as plasminogen activators. Plasminogen activators. So examples like streptokinase, urokinase, and recombinant tissue plasminogen activators. And apart from that, there is a factor 12A, kallikrein, as well as tissue plasminogen activator. So the mediators here, they activates the plasminogen to plasmin. Plasmin is a fibrinolysin, causes the lysis of fibrin mesh system. Generally, fibrin is a insoluble, and that fibrin in presence of plasmin converts it into soluble fibrin fragments. That is, prevent the clotting formation. And the drugs like streptokinase, urokinase, these are the fibrinolytics or thrombolytics. They prevent the clot formation. They prevent the thrombi formation. They prevent the embolus formation. But these are the drugs like epsilon amino caproic acid, EACA, tranexamic acid, eprotinin. These are anti-fibrinolytics. అంటే ఒకవేళ ఫైబ్రినోలైటిక్స్ లేదా థ్రాంబోలైటిక్స్ లేదా ఈ డ్రగ్స్ యొక్క యాక్షన్ ఓవర్ డోస్ ఏదనుకోండి ఏం చేస్తాము ఆ ఓవర్ డోస్ తగ్గించడానికి యాంటీ ఫైబ్రినోలైటిక్స్ ఇస్తాము సో ఎగ్జాంపుల్స్ లైక్ EACA ఎప్సిలాన్ అమైనో క్యాప్రోయిక్ యాసిడ్ ట్రానెక్సమిక్ యాసిడ్ ఎప్రోటినిన్ అండ్ దీస్ యాంటీ ఫైబ్రినోలైటిక్స్ inhibit the conversion of plasminogen to plasmin. So that plasminogen involves in the generally if plasminogen not converts to plasmin, there is a no availability of plasmin, there is a no degradation or no prevention of clot formation. So the line I mentioned here clearly, plasmin is a protease that acts to dissolve fibrin blood clots. So fibrin blood clots ni dissolve చేస్తుంది. సో సేమ్ ఇక్కడ మనం ఆల్రెడీ మాట్లాడుకున్న వాటి గురించి కింద నేను టేబుల్లో మెన్షన్ చేశాను క్లియర్ గా సో యాంటీ ఫైబ్రినోలైటిక్స్ సో రిమెంబర్ సో ఆల్ ఫైబ్రినోలైటిక్స్ ఆర్ థ్రాంబోలైటిక్స్ ఆర్ ఏజ్ ఎంజైమ్ like urokinase, streptokinase, alteplase, reteplase, tenecteplase. And apart from streptokinase, urokinase, remaining all drugs are recombinant DNA products. The recombinant DNA products are safe because of low risk of bleeding as well as low risk of allergic reactions, but it is expensive. Okay, so here clearly the anti-fibrinolytics block conversion of plasminogen to plasmin and inhibit fibrinolytic activity. So these drugs preventing conversion of plasminogen to plasmin, then inhibit the fibrinolysis. Nothing but preventing the fibrinolytic action. So examples like epsilon amino caproic acid, tranexamic acid. The route of EACA oral or IV, and coming to tranexamic acid oral, IV as well as topical administration. Topical administration. And when this EACA, antifibrinolytic, used in which condition? Control bleeding due to overdose of fibrinolytics. సో ఆల్రెడీ చెప్పాను కదా, ఎక్కడైతే ఫైబ్రినోలైటిక్స్ లేదా థ్రాంబోలైటిక్స్ యొక్క డోస్ ఎక్కువ అవుతుందో ఆ డోస్ ను తగ్గించడానికి ఈ డ్రగ్స్ యూస్ చేస్తారు. ఎస్పెషల్లీ ఆఫ్టర్ టూత్ ఎక్స్ట్రాక్షన్ అండ్ prostate surgery in the hemophilia. So hemophilia is the condition, a type of bleeding disorder due to deficiency of anti-hemophilic factor, clotting factor 8. So clotting factor 8 is also known as anti-hemophilic factor. If there is a deficiency of clotting factor 8, what will happen? Hemophilia, a type of bleeding disorder. I hope, are you understanding all the things? Everything is going okay, I think. And regarding tranexamic acid, control bleeding due to excess fibrinolytic action following tonsillectomy, removal of tonsils, prostatectomy, removal of prostate gland, tooth extraction as well as menorrhea. So during this condition, the tranexamic acid is useful. Regarding epsilon aminocaproic acid, it may cause muscle tooth pain. It may causes death of cells in the muscle. And regarding tranexamic acid, the side effects are like diarrhea as well as a headache. Diarrhea as well as a headache. Okay.